Hey guys, it's Sen from Sin City Neuro MP. Today I wanted to give a little talk on delirium. What it is, what causes it, who's at risk, and how to treat it. And how is it different from dementia? So delirium is a sudden onset change in mental status. You can have hypoactive delirium, hyperactive delirium, and mixed. So hypoactive is when you're sleeping all the time, maybe not interacting very much at all. Then there's hyperactive, where you're very agitated, maybe a little more fidgety and active and just a little more doing a little much. And then mixed, where you have both. So delirium often happens it often happens during severe illness, urinary tract infections in older adults, after surgery, polypharmacy, patients are on way too many sedating meds, alcohol withdrawal, delirium tremens, and there's so many different things that can cause it. Pneumonia can cause delirium. Anybody who just is really sick and in a hospital setting where they don't know where they are, that's delirium. Delirium, they may have hallucinations. All kinds of different things can be going on during delirium. Maybe they're just disoriented. Maybe they just don't know where they are. And throughout the day, maybe at some point they get a little better, and then all of a sudden they get worse again. So that is delirium. And the people who are at risk, obviously those who are critically ill, older adults. Older adults are at an increased risk because they have decreased cognitive reserve. Because as we age, our brains, they do atrophy a bit, and there's changes that happen as we age. Patients with dementia, so underlying dementia, is going to put you at an increased risk for delirium. And alcoholics. So if an alcoholic suddenly quits drinking, they can develop delirium, which is really dangerous because then they can have seizures, and sometimes those seizures don't stop. And how we treat it is, well, if it's delirium tremens and we know it's alcohol withdrawal, then we make sure that we treat that. If it's a UTI, we make sure that we treat that. If it's different types of antibiotics or medications, then we look at those things and we adjust them so that we can control the delirium. And it goes away with time, but it can take some time to improve. Now, individuals with dementia, though, they may take a little bit longer to get back to their neurological baseline. And sometimes with dementia, their neurological baseline can be pushed out a little bit when it comes to delirium. But delirium is an acute onset thing. So it's not dementia. They're not the same thing. But you are at an increased risk of it if you have dementia. Okay?